This week marks Tinnitus Awareness Week. Doctors say it's a condition that affects more than 50 million individuals in the U.S. alone.
In this Healthy Colorado report, KRDO 13's Bryn Carmen meets one doctor who explains some misconceptions about it and how to get help if you suffer from it.
Tinnitus is when you experience ringing or other noises in one or both of your ears. The noise you hear when you have tinnitus isn't caused by an external sound, and other people can't hear it. It's a poorly understood auditory disorder and affects about 15 to 20% of people and is especially common in older adults. A Colorado Springs doctor explains it as a phantom perception on sound, and the brain misjudges the volume it requires or wants, and then the brain produces its own sense of sound. She says some people hear music or loud scraping or banging. In some cases, it can be debilitating. Tinnitus is usually caused by an underlying condition such as age-related hearing loss, an ear injury, or a problem with the circulatory system.
Sometimes it's causal based on what's happening in your environment, and then other times it's just something you have to deal with all the time. The goal is that we retrain your brain to view it as a non-threat versus a threat, so that you just don't pay attention to it.
For many people, tinnitus improves with treatment of the underlying cause or with other treatments that reduce the noise, making tinnitus less noticeable. There's no cure, but Dr. Iliff says her hearing issues and other stresses from other people can make tinnitus worse. She says there are ways to retrain your brain to help this, and many of her patients have found it improves their tinnitus, making it far more manageable. In the studio, I'm Bryn Carmen, KRDO 13.